with the Rocket Right Show. I'm Dr. Kay Seller in the house with Hurricane Betsy Barnes. And our medical segment is brought to you each week by Mary Bird Perkins, Our Lady of the Lake Cancer Center. And we're so glad to have Dr. Nathan Hite, who's a colorectal surgeon with Mary Bird Perkins, Our Lady of the Lake Cancer Center, because March is Colon Cancer Awareness Month. And so we want to make everyone aware of the things that they need to do, which a lot of people dropped off their screening last year during COVID, I know. But let's just start with the basics. Let's talk about, because some people will go, are those different? What's the actual difference between colon cancer, rectal cancer, and colorectal cancer? Because they hear them used a lot the same, and they're like, what's the difference?
Sure. Whenever we say colorectal cancer, it can include both colon and rectal cancers. The colon is the longest part of your of the large intestine. It's about 5 feet. The rectum is actually just the last 10 to 15 inches of the colon, and it's in a more fixed location than the colon.
Yeah, so a lot of people, when we're going to talk about screening here in a little bit, but it's just like when I was practicing, would try to talk people into their mammograms, but I don't have any risk factors. Do I really need to do that? So let's talk about what are some of the risk factors.
Sure. I think there's a lot of reasons that people should get a colonoscopy. In terms of just age, the older we get, the more likely we are to have polyps. The general recommendation is 45 years to start screening colonoscopies at the current time. In terms of other reasons why somebody should get a colonoscopy, if they're having symptoms such as some abdominal pain, maybe some bleeding, a change in their bowel habits, it's important to see your doctor to see if you would benefit from a colonoscopy. If you have a family history of colon cancer or colon polyps, it's also very important to see your doctor to get set up for a colonoscopy.
Right, and I hope people noted, he said the age for starting screening now is 45, and a lot of people still have 50 in their head, and that changed.
It changed fairly recently. One of our organizations recommended 45.
Right.
Some still say 50, but either way, I think it's important just to get it on your radar, and 45
Absolutely.
is a good age to start.
Yeah. So let's talk about the ways. You mentioned colonoscopy, which I think is still the gold standard, but some people are like, well, can I do that like mail-in thing, or can I do this other thing, because I just really don't want to do a colonoscopy. Let's talk about some of the other screening techniques that there are, and the plus and minus.
The screening techniques for colorectal cancer have actually come a long way. There's still stool tests. Sometimes you would need to send in the stool sample. The big difference is these days they can actually test for pretty advanced things like DNA from polyps.
Right.
And they still can test for blood. Sometimes if someone just doesn't want to get a colonoscopy, they can also get a special type of CT scan that can evaluate for polyps. I think the big thing to remember, though, is that, like you mentioned, the colonoscopy is still the gold standard, and most importantly allows us to intervene if we see anything suspicious.
Right. So it's not just a screening technique where they go, yeah, you got something, you got to come back later. If there's a worrisome looking polyp, or if there's a polyp, then that can be taken care of at the time, sent off for pathology, and know what you got. And it may change the frequency of your next screening if it's precancerous or even benign.
And then just to note, for the special CT scan, you still need to do the bowel prep, which is probably the worst part of undergoing a colonoscopy.
Right.
And then, although the stool tests are pretty good, about 10% false negative and positive rate, they still can miss things. And if it's positive, it still would be important to get a colonoscopy.
Absolutely. And people don't realize, yes, the doctor needs to be able to see in your colon, which is why you've got to do the prep. It doesn't work without the prep. So let's talk about, in addition to the average person starting screening, what are some reasons that people might need to start screening earlier?
Sure. A family history of colon cancer. It's very important to know if any immediate family members have had colon cancer, because you probably need to get screened about 10 years before that person was diagnosed, or start screening at that time. And like you previously mentioned, the interval is a lot shorter than if you didn't have a family history of colon
But wouldn't
cancer.
that put you in your 20s or 30s getting a test? Yes.
It could.
It could.
So this is not limited to people. We want people to understand there are some questions you might not want to ask your parents or your your relatives, but this would be an important one.
It's unfortunate, but believe it or not, we're starting to see colon cancer at a a higher incidence in younger people. It's not very common in the 20s to 30s, but we have seen it, unfortunately. So it's definitely important to have that conversation with your family member.
If you have that family history.
Exactly.
And I think the studies showed that's why the age moved up to 45 from 50 because of the increased incidence.
If you have certain family history of genetic syndromes, like FAP or hereditary non-polyposis colon cancer, which just means you have a lot of polyps in the colon, that's also important to start screening at a much younger age.
So let's talk about that screening. Screening means you have no symptoms. You're doing this for prevention.
Right.
So what are some other symptoms that people should look for that might not mean colon cancer, but it certainly means I need to tell my doctor about this, and I might need to be getting some tests done?
I think some important things to look out for: a change in your bowel habits. Maybe you find it harder to go to the restroom if you need to take stool softeners, and in the past you were not. Bleeding, of course, is an important thing to take note of.
Right.
The majority of times, luckily, it's from a benign cause or something unrelated, but it's still good to take note of those things and have a conversation about screening.
Sure. I mean, the best thing is always notify your doctor. If it's something alarming, get tested. The most likelihood, like you said, is a benign thing, but you want to catch it early. If it's not, you don't want to just ignore it and go, well, that'll probably go away.
Exactly.
You know, and I think the majority of people will see their doctor when they have some rectal bleeding because that's alarming, but sometimes they'll just chalk it up to a hemorrhoid. So, if they don't have that history before, they need to be given a call.
Absolutely. And like I tell a lot of my patients, we want to find nothing.
Right. Absolutely.
And it's colorectal surgery clinic, so we do a lot. We look at a lot of people's bottoms, I guess. We take our work seriously, but we don't take ourselves too seriously. And we're your doctor, so we want to provide the best care for you, make sure everybody's comfortable. So we never want somebody not to come into their appointment because they're embarrassed or they feel like it's silly.
Absolutely. So the Cancer Center earned a national accreditation for its rectal cancer care. Like talk about that honorable recognition. What does that mean? I know Mary Bird is just doing great things, but what is this all about?
I'm really proud to be a part of the team at Mary Bird Perkins, and basically it was a process that took over a year to implement, but it's basically the NAPRC, and it's a national program to ensure quality care for patients with rectal cancer. Rectal cancer is very complex. There's quite a few ways to initiate and to complete treatment. It basically holds everyone to a very high standard in the care of that patient, and by that I mean there's multiple teams involved, not only your surgeon, but also your oncologist, your radiation oncologist, geneticists, social workers, everybody, to make sure that the patient gets the best care.
So, and I know that, Mary Bird is cutting edge on all of their treatment. So talk a little bit about, and we don't have a whole lot of time to spend, but just some of the advanced treatments that y'all are using for colorectal patients.
In terms of just strictly the surgical aspect, I'm really proud to have a great team of 4 great partners, Louis Barfield, Kelly Fine, and Richard Bird. We all do advanced, minimally invasive surgery, and that can range from anything from laparoscopic surgery to robotic surgery with the Da Vinci robot.
Which, in the past, if folks aren't thinking about that, little incisions, and they also have a much better recovery than when they had to have a huge incision as far as their post-op recovery period.
Exactly. A lot less pain, a quicker return to activity, less chance of having a hernia. People just feel better, they do better, they get out the hospital better, and take probably less narcotics as well. So. And
if they had to do any adjuvant treatment, then they can usually start that sooner because of the less time for the healing of a large incision.
Exactly.
And that also would help people who have other illnesses or conditions. I actually know a couple of people that y'all have done surgery on and really helped, and they were older and they had some other issues, and y'all took great care of them. And Mary Bird Perkins, everybody just is so deeply invested in the outcomes for their patients.
Absolutely.
Yeah.
So let's say if anyone wants to find out more information on colon cancer, where's the spot?
We can go to the Mary Bird Perkins website. And
marybirdlake.org/colon colon. It's up there on our website. And before we go, we want to know a little bit of stuff about you.
Sure.
How long you been here in Baton Rouge?
I grew up in Louisiana. I actually grew up in Destrehan. I went to undergrad in medical school at LSU and also did my surgical training at LSU. So I did my fellowship in Seattle and actually spent a little time at Oxford as well. So I've been all over.
Yeah, that's wonderful. We're glad you came back to Louisiana.
Well, I'm happy they would have me back.
Yes, and you actually probably run into now and then people that you know. And so we're so glad that you're there to just care for and treat our home folks, you know, from all over Louisiana, because Mary Bird does attract patients from all over the South.
Absolutely.
It is really an exemplary facility, and we're just so thankful for the people that we get to meet on a regular basis through Mary Bird.
Yes.
Great.
We have been talking with Dr. Nathan Hite with Mary Bird Perkins, Our Lady of the Lake Cancer Center, colorectal surgeon. It's Colon Cancer Awareness Month, so y'all, please check and see when the last time you were screened. Are you due to be screened? Talk to your doctor about it. And don't procrastinate on this. We know a lot of people have delayed their screening because of last year's COVID. We want you to get back on track. Thank you so much for joining
Thank you.
us.
I appreciate you
We
having
always
me.
appreciate it. And coming up next, we're going to be talking some City Slice Pizza and lots of happenings there.